Let's turn our attention to healthcare and affordability. And Ms. Slotkin, I will address you for this first question. Research from the CDC shows the high cost of prescription drugs has prompted more than 9 million American adults to either skip taking their medication, put off refills, or take smaller doses. It's heartbreaking. And then there are those who are worried about the bigger picture, and rightly so. Lena A. from Flushing posted this question. As healthcare costs continue to rise, many Americans struggle to meet basic medical needs. What ideas would you propose or support in order to attain an affordable healthcare system while maintaining high-quality medical care?
Yeah.
And you have 60 seconds.
Well, this one is particularly personal to me. I lost my mother in 2011 from ovarian cancer. And when she died, she did not have medical insurance. So the same week we're finding out about her diagnosis is the same week and the same month that we're filling out the paperwork for her to declare bankruptcy. I believe that in the United States of America, all people deserve access to health care they can afford, and prescription drugs are way, way out of people's price ranges. So I don't have to imagine what I would do on this issue. I have done it. We have voted, finally, to allow Medicare to negotiate drug prices. Everyone understands Costco. You go to Costco, you buy in bulk, you get a lower per unit price. Medicare was prohibited from negotiating drug costs, just like Costco. Why? Because people like Mike Rogers voted for it 5 times. He voted for it 5 times. How is it possible to vote against Medicare negotiation to bring down the price? For me, we start there, and we continue to add more and more drugs that we can negotiate and get cheaper prices.
Thank you, Ms. Slotkin. Mr. Rogers, what ideas would you propose or support to attain an affordable health care system while also maintaining high-quality medical care? You have 60 seconds.
Yeah, thank you for that. Listen, this is also personal for me. I was a cancer survivor at the age of 19. We were able to beat it. I went on to the United States Army and served as an officer and a special agent with the FBI and went on to Congress. Amazing. My father also was a cancer survivor, had kidney cancer, pretty rough go of it for a long time there, but he beat it. I think he was, as my family would say, tougher than woodpecker lips in order to beat that thing. But I will tell you this, when we hear this kind of rhetoric about, oh, if you don't do this, it's this, the bill that they supported still has our prices. I'll give you Ozempic as an example, is $800. In France, it's $80. It means the United States is continuing to support the rest of the world when it comes to research, development, and cost of prescription drugs. I would go back. We're going to make sure we do average sales price, including international, to bring their prices up and our prices down. We should not be paying for foreign governments medical and medicine when it comes to prescription drugs.
Thank you, Mr. Rogers. Ms. Slotkin, 30 seconds.
This
rebuttal.
is rich. This is rich. This man voted 5 times against Medicare negotiating drug prices. So now he's claiming, oh, he's upset that France pays less than us. He did that. You're upset that Canada pays less than us? He did that. He voted 5 times. That's not, as a matter of public record. Google it, right? It's very, very open. It's public information. So the idea that someone who voted against Medicare negotiating somehow now is the champion of it. I got a bridge I want to sell you if you think this guy's going to protect you.
Thank you, Ms. Slotkin. Mr. Rogers, 30 seconds rebuttal.
Look at the prices that have gone up in the last 6 years when my opponent was in office. Not only prescription drug prices and premiums, but premiums in health care. So some notion that today she has the gall to stand here before you and say, oh, everything's wonderful on your prices. It is not. And it's not because of the way they approached this. And they did advantage foreign governments over U.S. Providers in Medicare. I put Medicare prescription drug when I was in Congress way back when as a part of Medicare. First time it's ever happened.
And
that
Chuck,
was me.
You have the next question.